This webinar provides an overview of root cause analysis in the New South Wales health context. I would like to acknowledge the traditional custodians of the various lands on which we work. I pay my respects to elders, past, present and emerging, and recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. This webinar gives high-level guidance on root cause analysis. We encourage you to first listen to the Changes to Serious Incident Management in New South Wales webinar on the Clinical Excellence Commission website or YouTube channel for an overall understanding of the Serious Adverse Event Review requirements. Root cause analysis, or RCA, is one of 4 approved review methodologies used in New South Wales. For each clinical harm score 1 incident, the Chief Executive determines the review method to be used. Regardless of methodology, all review processes seek to answer 3 questions: what happened, why it happened, and what action we can take to prevent it happening again. At the Clinical Excellence Commission, we have structured all of our resources and training around how each review method addresses these questions. Our review team follow 11 steps to complete a root cause analysis in New South Wales Health. When seeking to figure out what happened using RCA, there are 4 steps that the team follow. The team leader provides team members with access to the incident report, medical record, preliminary risk assessment, and any other relevant documentation for review prior to the first meeting. At the first meeting, the team develop a shared understanding of the event by constructing a simple flowchart. This outlines the chronology of the incident from the first known fact through to the final event. The team used post-it notes to construct an initial flow diagram of 5 to 6 boxes. Next, the team determine what additional information needs to be gathered. They review each flowchart box and figure out what they know and what they still need to find out. They use the RCA triggering questions to assist with this step. The team then establish how they're going to gather the information and distribute tasks for completion before the next meeting. The Serious Adverse Event Review team collect information using a number of methods. This will always include staff interviews. Patients, carers and family members are invited to meet with the review team. The dedicated family contact will initiate this offer. We repeatedly receive feedback from staff that interviews following a critical incident can be highly stressful. One of the key tasks of someone completing an interview for an RCA is to establish a safe environment where staff are open to speak and have the ability to recall what happened. In setting up the interview, they explain the boundaries of review, letting the staff member know that we are seeking to learn and prevent similar incidents from occurring again. It's not about apportioning blame, rather we're looking at how to improve systems of care. In doing so, the RCA team member needs to explain how the information gathered will be used. They let the person know what will happen during the interview, what happens with the information afterwards, and how the person can expect to receive feedback. The team acknowledge the personal impact the incident may have had on the staff member. Once all of the information has been gathered, the team come together to just construct a final flow diagram. This provides a detailed chronology of factors leading to an event. The team should then identify where barriers may be put in place to prevent the problem occurring again, and this is signified by the red vertical lines. To answer why an incident happened, the team follow 4 steps. Step 5 in the process is to identify factors that caused or contributed to the incident using a cause and effect diagram. The cause and effect diagram assists in analysing the relationships between a problem and its causes. It's a systematic way of combining the previous brainstorming, information gathering and flowcharting tasks. For each barrier point, the team drilled down using the 5 whys technique to create a causal chain. The team then link the identified factors to the outcome to clearly define why something occurred. Factors focus on processes and systems, not individuals. So our first example is of linking a factor to an outcome is that informal handover practices led to the wrong patient being discharged. Alternately, causation statements can be used to link factors to outcomes. In some local health districts, the Director of Clinical Governance may state a preference for this approach to linking a factor with an outcome. A causation statement has 3 parts: the cause, the effect, and the event. If we look again at that example previously discussed, a causation statement may read as follows. There were no procedures established or expectations regarding formal handover of identification of patients, thereby increasing the chance that patients would be misidentified. This resulted in the patient being discharged and without full review with undiagnosed myocardial ischemia. The team then determined the practices, processes, or systems that could be reviewed. And so following on from that example, the area for review would be handover practices in the emergency department. The team go on to write the findings report. So let's have a look at what this includes. So the findings report provides a description of the incident, including a sequence of events. The team identify how the incident occurred and list any underlying factors linking them to outcome. And the team also identify the areas for review. When the findings report is finalised, it's submitted to the Chief Executive, who's responsible for directing whether a recommendations report needs to follow. The findings can then be shared with the family by the open disclosure team, and it's the dedicated family contact who arranges this. Teams who go on to develop recommendations follow 3 steps. The team brainstorm actions that could prevent the incident or mitigate harm, and in doing so, they give consideration to any recommendations that may have been made by the family. The strength of each action is assessed against the action hierarchy, trying to ensure that at least one strong or intermediate action has been identified for each factor. At this stage, the team consult with other services if actions are recommended for a service that's not represented on the review team. This is an example of an action hierarchy. It states that stronger actions are ones that are the best at removing dependence on the human to get it right, while weaker actions support or clarify processes but rely solely on the human. So stronger actions look at review or redesign of processes to ensure staff take the right action, whilst weaker ones remind staff of what the right action to take is. For each recommendation, an action plan is developed that includes a due date, outcome measure, a person responsible, and an oversight committee. The team finalise the recommendations report and submit to the Chief Executive for approval. When the report is approved, it's submitted to the Ministry of Health with the findings report. Let's have a look at where you can find out more information about RCA. You can visit the Clinical Excellence Commission website where you'll find a root cause analysis toolkit. This toolkit includes step-by-step guidance on the process to follow for a root cause analysis. There are detailed instructions and examples of tools that have been populated. There is also an RCA workbook for teams. The workbooks have been designed for the teams to work through during their meetings. They break down all of the steps into meetings, and each meeting has a checklist of steps to be completed, and the templates are empty with instructions on how to complete that. The workbooks also include lots of planning templates like Gantt charts, forms to fill in, and so on. Thank you for listening to this summary of the steps in the RCA process in New South Wales Health. Keep an eye out for serious adverse event review training programs by checking the Clinical Excellence Commission website. Please contact us with any questions on our email address.